Hello and welcome to Health Bytes. Health Bytes is brought to you by the Public Health Unit of the Ministry of Health and Social Development. I'm your host, Public Health Communications Specialist, Natasha Letsom Humphrey. Today, we're talking about Med Safety Week, which is coming up from November 6th through the 12th. We have with us our Chief of Drugs and Pharmaceutical Services, Mrs. Gracia Wheatley Smith, here to talk to us about medicine safety. Welcome to the program, Mrs. Smith.
Thank you, Mrs. Humphrey.
Now, to start us off, talk a little bit about the origin and purpose of Med Safety Week.
Med Safety Week, hashtag Med Safety Week, actually was begun by the Uppsala Monitoring Center in Sweden. That's the global institution for monitoring medicine safety around the world. So it is an initiative to raise awareness via our social media platform in spreading the message to folks, to health professionals, that they must report any side effects or adverse drug effects experienced when taking medication. Because upon investigation, then recommendations can be made as to that particular medicine after it's compared with all global forms submitted. So, should we take this medicine off of the market because it's doing too much harm than good? Should we reformulate it instead of giving it as an injection, maybe as a suppository? Should we just have specialist doctors who would monitor you more closely with laboratory results? Should it just be for them to prescribe or something like that? So it started since 2020, and this is our second year with the campaign in trying to get out to the BVI community the importance of reporting to your health professional, your doctor, pharmacist, a nurse, or even you reporting of any effects of a medication.
So, tell us a bit about this year's theme and its significance.
This year's theme, we are looking at who can report. We want to raise the awareness of pharmacovigilance. And who can report? Our doctors. Sometimes the side effect we may experience may not seem that important to a doctor to sit down and do the paperwork. Our nurses, the same thing. She's tending to so many patients. She may not have time to do that. And our pharmacists, who are always busy because there's so many people collecting medication, may not have time. But we want to highlight the importance of reporting to the pharmacist, the doctors, the nurses, the patient themselves, or even caregivers of patients there, like children. Has your child had an effect? Report it. Are you a caregiver to an elderly? Report it.
In terms of drug reactions, we were talking about that. What is a reaction and how do we know if we're having one?
Well, a reaction would be any event that occurs after you take the medication. That is a reaction. So you can know you're having one because sometimes you can feel it, sometimes you can see it. I may get hives on my arms or bumps. Okay, I may experience dry mouth, dry eyes. I may get a headache. There are things that you can experience, things that you would be able to tell the doctor. Well, I am burning on urination. I'm more constipated. Things that are not what it normally is with your body. When you're taking a medication, you can be suffering a side effect. Now, an adverse drug reaction is a side effect is a reaction that you expect because of the nature of a medication, such as antibiotics. Well, naturally, we know antibiotics work by dealing with the bacteria in your gut. So, of course, if you kill off everything, what's going to happen? You're going to have diarrhea. So, anytime an antibiotic is prescribed, you may think of, because not everyone will get a side effect, but you may get diarrhea as a side effect. In ladies now, because of the unbalance an antibiotic may cause when you're taking it in the vagina, you may find that you get a yeast infection because the antibiotics deal with bacteria. It doesn't deal with fungi and viruses. So if the bacteria is absent, then it gives the fungi, the Candida albicans, time to rise up and shine. And then we find that we're experiencing itching, foul smelling, and so forth. So that may be one side effect because of the nature of the antibiotic. It kills the bacteria. Now, an adverse event is something that you experience, and it is not because so much of the nature of the medicine, but it is because you took the medicine to control your cough, but now you are having a different experience. So that is a adverse event, and it is a bit more severe than a side effect.
And why is it important to report these adverse events?
Well, as we know, medicines are foreign entities that we are putting into our bodies, and they have to work with our bodies and exert an effect. Now, if I take a medicine and I have a reaction, we submit a report to this global monitoring center. If you take a medicine and have the same reaction, and that report is submitted to the same global institution, and around the world, St. Kitts, Australia, Sweden, wherever, and all of these are compiled in the global database. And then we have investigations being done. At that time, they can make recommendations and said, okay, like I said, we need to reformulate this because giving it by injection is causing too much side effects. Or let us recommend to the manufacturers that we need to pull this from the market because the benefit ratio is just not there. Or because according to what happened, what event happened, then we have had so many persons who have unfortunately died from this experience. Well, therefore, it is too deadly to have it on the market. So therefore, we can make that recommendation. So the pharmacovigilance of adverse event and side effect reporting can lead to some very strong actions with manufacturers or even with prescribing habits, prescribing doses, formulation, who should prescribe this medication because of now the education that is going to be needed. And that is the importance of reporting. That is on a global scale. But to us home on a local scale, the importance of reporting can go to us personally. Because if you experience a side effect, here, let us say in Tortola, and then you go overseas and you are accessing care overseas, they don't have your medical records here in Tortola to look and see that you have had a reaction. So when the reports are submitted to the Office of Chief of Drugs, what is done is analysis is done. And when it can say, yes, the side effect happened because of this medication, as a result of this medication, a card is produced with your name, your age, what event you had, and information as to how to contact, be it your mom or the health professional who actually did the reporting. And that card is the size of a credit card that you can keep in your wallet. So if you go overseas now and you're accessing care, you can share that with a physician and say, well, I cannot take this drug because this is what happened to me when I take it. And that can be life-saving because actually that happened with a patient here. They had a bad reaction to a medicine and they went overseas. And while they were there, they had to visit a doctor. And when they went to the doctor's office and they pulled out the card, he said, this is the same medicine that I was going to prescribe for you. But because you had this reaction with this medicine, I will have to give you something else. So locally, it has its benefits in reporting that we can have that local information traveling with us when we do not have access to our medical records here in Tortola. And globally, it has effect where we can take steps that can reduce use of that medication in the future, maybe a smaller dose, maybe the way it is administered, and thereby reduce harm and increase medicine safety.
Wonderful. I love how you took your time and explained the whole process locally, internationally, the benefits to reporting. So now here locally we have a case where someone, took, medicine A and is having an adverse reaction. What is the process? What do they do?
What do they do? They can call their doctor. That is the first thing that they need to do. Make sure you get in contact with your physician who can advise you according to the experience that you're having. If you discontinue, or he will reduce the dose and see where it goes from there according to your medical condition. So if you get in contact with your doctor, he or she is free to say how you should go forward. But then that physician should, should fill out the form, the adverse reporting form, and still submit it, because then investigations can be done. We can look at the local register here to see if we've had complaints with that medication and can take it from there. So they can speak to their nurse and they can look about assisting with the filling out of the form. They can speak to the doctor or even the pharmacist.
So, question, whose responsibility is it to file the report? Is it, the pharmacist or the doctor, or is it the individual who is experiencing the reaction?
Well, the responsibility begins with the patient, because unless you come and you report to me that you're having this experience, I don't know. If the patient is in hospital, however, the doctor, the nurse, or even the clinical pharmacist may be able to pick up that it is an adverse event. So, but there are adverse events that you would not be able to see or you would not be able to feel. So we have symptoms that you can see, that you can experience, and we have symptoms, we have effects that affects like our liver and our kidney, and unfortunately those are only seen if you do laboratory work.
So what happens once you make the report? Now, you said that there is a card that the reporter would be able to have to ensure that, they don't have another reaction from the same drug. How do they go about getting this card?
After the report is submitted to my office, then the analysis is done, and then I contact them to come and pick up the card from the office.
Oh, so once you report, a card is automatic. This is not something they would have to inquire about.
No. The card would be automatically generated so they can have it for their personal record.
Okay. And how can the BVI community, including, the doctors and pharmacists, help to promote reporting?
Well, they can promote reporting by getting access to the form. If a patient is reporting something, no matter how mild it is, it can be, like I said, just a few bumps that come up, they can report it. So once they see something, you hear something, you smell something, you report it, and they can also, in the interview with their patient, when they're prescribing, they can ask, have you had an allergy to this drug? Have you had any reaction at all to this drug? If when you took this drug, did your stomach hurt you? If it is a drug that can have such an effect like aspirin or an NSAID, that maybe can cause an ulcer. So, yes, by inquiring as to how the atmosphere is or the culture is that happened when the patient was taking that drug, or even if they know a patient's lifestyle, because there's some medication that is affected by your lifestyle. There's some medications such as Cipro, because it causes photosensitivity, which is light sensitivity, like this light is here glaring at me now. If I were on Cipro, I should not be under that light. Or I should not be spending, like if I like to garden, I should not be spending 2 hours in the sun continuously. Or I can take precaution, put on a hat, put on some long sleeves, put on my gloves, and spend time in the garden. Or I shouldn't go on the beach and just sunbathe, because of that reaction that would cause with that medication. So if your patient is hypertensive or has cardiac problems, then in prescribing a cold medication, you can warn them about what they may experience as a speeding up of their heart rate because of that medication that they're now getting. So please report to me, call me back and let me know how this medication is working for you. What are you experiencing, or is everything smooth and going fine?
I love that. I would definitely love to see, doctors being a bit more interactive with their clients, their patients, following up on stuff like that, because we know here in the territory we played with a lot of NCDs, and we have a lot of people on multiple medications, which could interact with each other and have adverse reactions. And to the beginning, you spoke about pharmacovigilance and, your whole quest to promote pharmacovigilance here in the territory. I want you to bring everything into perspective as we wrap up in terms of, reporting pharmacovigilance. You spoke about knowing, the names of your medications, knowing how it has affected you. If your doctor, has not brought it up with you, you bringing it up with them. The
Oh,
the
yes.
personal responsibility of the client to be empowered in their own healthcare and their whole own healthcare access. Wrap it up nicely for us while promoting pharmacovigilance and just, empowering clients right now, so they could have the best possible outcomes.
Well, the word pharmacovigilance is two words. Pharmaco meaning drug, and vigilance, as we know in our BVI motto, being vigilant, looking out, and being aware. So in pharmacovigilance, we are actually looking and being aware because we know medicines, you take it, medicines hurt, but medicines can also harm. And that has been my motto. So we need to look out and see. And pharmacovigilance consists of so many things within it. So we are looking at side effects reporting. We're looking at adverse drug reporting. We are looking at product complaints because that is also part of pharmacovigilance. Because a medicine is made doesn't mean it would work automatically or that it would be as therapeutic as it should be. There are some medicines who, because of the excipient or the extra ingredient that is put to make it bulky for you to take as a tablet, may not agree with you. And then, of course, we know we have counterfeit medicines and they are so smart that somehow they've managed to infiltrate the supply system and they get into our pharmacy, they've gotten into our hospitals. I'm not necessarily saying here in Tortola, but I'm not saying that we are exempt either. But there have been reports of where counterfeit medicines have been administered to cancer patients in the U.S. Unfortunately, those patients died, and then it was discovered that it was counterfeit medicines that they were getting. So, of course, the cancer got out of control. There was a case in Africa, in Nigeria, where the quest of the medicines agency in Nigeria became personal because her sister was a diabetic and the insulin she was taking was water. And they could not figure out how her sugar was being so uncontrolled when she was diligently administering her insulin. And when they tested it, they found out it was water. Wow. And so that lady took on that case to bring all of those individuals to justice, and she had a quest against counterfeit medication. But like I'm saying, counterfeit medication can find a way into the system and can cause an adverse reaction, can cause a side effect. So investigating those medications and sending them to test is the only way to know the link of what happened. And then there's reporting of medication errors. If you don't report a medication error, how will we know how to fix the system? Now, reporting a medication error doesn't mean automatically that you will get fired. Reporting of medication errors is so that we can fix the system. Is it that there were so few nurses on per patient ratio that they were overworked and did not realize what was being given to the patient? Is it that the lighting in the hospital is so bad that they could not see the writing on the small vial or, So therefore, that can be a medication error. The long hours that we humans are expected to work in a hospital because it is a hospital setting, and we think it is good because we don't want to pay for more staff. But we must realize that fatigue sets in, and because of fatigue, your eyes get tired, your mental processing gets tired, and medication error can occur. So all of that is pharmacovigilance. How we are looking at how medicines work and how we can ensure medicine safety now and in the future for you and for all of us.
Wonderful. Final thoughts?
My final thoughts, I would just like us to get in the culture of reporting because I know that we have a lot of experience of adverse drug reactions and side effects in the territory. But we have, and I'm guilty of this as well, you take something and you get a little upset stomach, and so you discontinue it and you don't report it because you move on to something else. Mm-hmm. You go to the doctor, he sees you, well, I had this and this. Okay, I will give you this to counteract that. And that is it. There's no reporting. But if we report, we can improve medicine safety for all of us. And I'm so happy about that because at this time, I have had some adverse drug reactions and product complaints submitted to the office. And the product complaint, that medicine will be sent for testing, so we will know if the complaint that was submitted is truly what was happening. And those individuals who have had the ADRs or adverse drug reaction will get their card so that they can have on their person. So in the event of future prescribing, they will know that they cannot take this medication, and medicine safety will be accomplished through pharmacovigilance.
Wonderful, wonderful. We would like to thank our Chief of Drugs and Pharmaceutical Services, Mrs. Gracia Wheatley-Smith, for coming on the program today to share with us what could be some life-saving information. I'm not sure if you told us how persons can report. How can they get to you if they wanted to report an adverse drug reaction?
You can get to me with the telephone number 468-9850 or my email grwheatley-smith@gov.vg. And my final thoughts, let us celebrate #MedSafety Week so that we can raise the awareness of medicine safety locally and globally.
Wonderful. So we're asking you guys to play your part as we observe #Medicine Safety Week from November 6th to the 12th and beyond. We want you guys to get in the custom of reporting, in the habit of reporting adverse drug reactions, not just for you, but collectively for the community, for the territory, and on a large scale for the world. Reporting for the Ministry of Health and Social Development, I've been your host, Public Health Communications Specialist, Natasha Leadsom Humphrey. Thank you for tuning in.